Hi everyone, welcome to week number 8. This is a week where we're really going to start to kind of repeat chapters, but with that being said, I'm not going to go into a great deal about the whole chapter, but I'm really going to focus on the areas that will be pertinent for this week's labs. Also, because it is week 8, that means that Thanksgiving is on Thursday, and because Thanksgiving is Thursday, we will not be in class. So I'm going to give you this information, but we're really going to actually do and complete the labs next week in week number 9. So this week's chapters, we will focus on Chapter 4 and Chapter 6. Chapter 4, a little bit more with blood collection. Chapter 6, dealing with some chemistry issues and some chemistry topics. So let's start with Chapter 4. Chapter 4 is going to be focusing on the capillary puncture. But this week's going to be a little bit different. We're actually going to focus on how to collect a capillary puncture. Now, I know we've talked about capillary punctures for several weeks now, going all the way back to week 2, where we actually talked about the methodology. And remember that a capillary puncture is really considered a skin puncture method to retrieve blood. And it's important to remember that the composition of capillary blood is more like arterial blood versus venous blood, because the capillary blood draws blood from the arterioles, the ventricles, or venules, and the actual capillaries. So it's going to look more bright red as opposed to darker red. Okay. Also remember that capillary punctures are useful when you don't need a whole lot of blood, when you need just a small amount. When you've got patients who have burns or skin irritations or have small fragile veins. We also use capillary punctures with patients who are cancer patients or geriatric. They might also have patients who are difficult to draw blood on. Pediatrics, that's a great one. We don't want to really do venipunctures with children because there's so many risks involved with them being so tiny. And we also want to use the capillary puncture when a minimal amount of blood volume reduction is desirable. Also remember that some tests cannot be completed through a capillary puncture, but most can. Things that cannot be completed during a capillary puncture would be things like a coagulation study, unless you are doing a point-of-care anticoagulation test, ProTime. Blood cultures cannot be done via capillary puncture, and neither can erythrocyte sedimentation rates. Reason being is that they need a great deal of blood to do these, and the capillary puncture method just does not give us enough blood. I also want to talk about point-of-care testing. So when we talk about point-of-care testing, this really refers to places beyond the lab, places like the hospital beds, at home, nursing homes, or any direct contact with patients. And when we talk about doing the POCT, or point-of-care testing, there are really two types of collection methods: capillary tubes and microcollection or microtainer tubes. Now, when we talk about capillary tubes, these can be plastic or glass, but plastic really is preferred because of safety reasons. The blood with a capillary tube will actually move more freely into the tube than capillaries, or during microcollection, because it's actually got a little vacuum in it. Red marked tubes contain heparin, which keeps the blood from clotting. So if you remember when we did our hematocrits, we used red heparin tubes. That's what we're talking about when we talk about capillary tubes. The blue marked tubes do not contain an anticoagulant, which allows the blood to clot naturally. So when we did our hematocrit, we actually used a red top tube because we did not want any clots in it. We also can use microtainers, or microcollection tubes. And these hold more blood than your capillary tubes. And they also have a little lip on them that allows the blood to flow into the tube. So the lips are generally color-coded just like your vacuum tubes are, and they correspond to the anticoagulant present or absent in that container. You want to hold the microtainer tube at a 30 to 45 degree angle to allow the blood to run into the collection tip as opposed to scraping it across the blood specimen, because then it picks up dead tissue and it tampers with your sample. It's just like when we wipe away that first drop of blood. It's the same kind of concept. Now, every week since week 4, you've heard me tell you the order of draw, but for capillary punctures, it's a little bit different. Don't freak out on me, but it is different. You want to start with drawing your lavender top tube with that EDTA in it. This is to keep any microclots from forming, because this blood is going to flow right away. Towards the end, it's going to start to clot up. Okay. The second set of tubes that you'll draw will be ones that have anticoagulant additives in them, such as your green top tube, and it's generally followed by 2 blue top tubes, which are actually labeled tube 1 and tube 2, and then you'll do gray. So it's lavender, green, blue, gray, and then to end it, it is actually going to be that non-additive red top tube that's nothing in it. And that's generally because at this point your blood is starting to clot, and we don't need that tube anyway. Okay? So that's kind of a good review on capillary puncture and collection of capillary punctures. Let's talk about Chapter 6, which is really dealing with chemistry, but what we are going to focus on is stool specimen collection and running stool samples. So because cancer of the colon is one of the leading causes of death in the U.S., we perform fecal occult blood tests to have early detection. Okay? If caught early enough and it is still localized, it can be curable if the patient has cancer. The American Cancer Society recommends that a fecal occult blood test be a part of a routine physical exam, and that generally starts at age 40. This is a simple, inexpensive test to detect blood that may be hidden or not seen with the visible naked eye. This test is the aid to help diagnose a number of GI disorders, such as things like hemorrhoids, polyps, diverticulitis, parasites, fissures, colitis, or colorectal cancer. This test can be done in the office or sent home with the patient, and it's pretty important that we let patients know what we're doing, but you also want to tell them what they should look forward to. So you want to inform your patients to eat a high-fiber diet. And the reason is that this will consist of things like well-cooked poultry or fish. It will consist of cooked fruits and vegetables, bran cereals, raw lettuce, carrots, or celery, and moderate amounts of peanut or popcorn. So those are all going to be high fiber, so it's going to help move the digestive tract along. You'll want to also, you told them what to eat, you want to tell them what not to eat or what to avoid eating, because these may actually interfere with the process and give us a false result. They want to avoid things like red or partially cooked meats. They want to avoid turnips, cauliflower, broccoli, and parsnips. They want to avoid melons, especially cantaloupe, alcohol, aspirin, or vitamin C. The reason they want to avoid some of the fruits and vegetables is because they become very stringy and can get confused with being another GI issue. So you also want to explain to the patient how to take the various stool samples. So if you take it home with them, what you'll do is you will give them a test kit, and that test kit is going to have 3 different cards. And they want to collect stool from 3 different samples of the stool because we don't want to get the same sample over and over. So it's important to explain that to them, and they will use a wooden applicator to actually place the stool onto the card. And then what they'll do is either mail it back or they will bring it back into the lab where you will process it. Alright guys, so that's kind of a brief overview of a hemoccult test and a capillary puncture with collection. Again, please remember that due to Thanksgiving, we will not be meeting on Thursday, but we will meet next week, and we will perform all of these labs plus next week's labs. You still have to do your discussion post. Just because we aren't meeting on Thursday, you don't get out of discussions. So make sure that your discussion post is completed on Wednesday by midnight and your 2 responses on Saturday. I also want to remind you that we are heading into week 9, which means that your final diversity project will be due, along with your final resume project. So make sure that you're working on completing those and having them completely ready to go for next week. All right, guys, have a wonderful holiday, and I will see you next Thursday. Bye, guys.